Welcome, Dr. Mazique. Welcome, Dr. Sindass. Thank you for joining us.
Thank you.
Thank you.
Would you give us a brief summary and an update as to what the current status is as we address COVID, and basically to know more about, naturally, in the next, I guess, the next progression, what are we doing next in terms of the vaccine?
I am Dr. Mazique, and I do want to thank you very much for inviting me to this session today on behalf of CAFE. I would like to take this opportunity to give a very brief summary about the COVID-19 virus, and then Dr. Sindass will segue with the vaccines that are now approved and the ones that are on the horizon to be approved, and why it's absolutely necessary that everyone should be vaccinated. Well, as we know, the SARS-CoV-2 virus, it's a new virus that started in December of 2019, and hence the terminology COVID-19 to signify that year. The virus started and then quickly spread all through the world, and thus causing a pandemic. The new virus, initially, no one knew anything about it. But the one thing that we were sure of is that it was spread through respiratory droplets. By that, I mean, if someone were to cough and there was an aerosol of these tiny little particles in the air, then it was very easy for somebody to be infected. And these droplets would cause respiratory problems to the people who were exposed to it. Now, as time progressed, we realized how many more issues are as a result of COVID-19. So initially, we thought of the things that needed to be done. So for example, everyone was encouraged to wear a mask. We were encouraged to do our social distancing. We were encouraged to do our hand washing. And most of all, the people over the age of 65 were most affected. And so people in nursing homes, they were the ones that, suffered the most initially, as we saw how this virus evolved. Now, we also realized that the people who were having a lot of issues were people who had what we call pre-existing conditions. And by that, I mean people who were diabetic, who had chronic kidney disease, people who were obese with heart conditions, etc. Those were the people that were very, very severely infected. Now, the other thing is that we saw is that there was a huge disparity in the population that actually were infected with COVID. And the population were the people who actually were from backgrounds where a lot of brown and Black people lived. And the reason for that is there was a lack of access to health care. They were disproportionately dying at a great higher rate because of lack of insurance, just a lack of knowledge about the virus and how it should be treated. So a lot of education was done around that, and we're hoping to, as time goes on, even with the vaccine, to close those disparities so that we can effectively, get ahead of this virus. As you know, there's not a treatment for it, but like Dr. Sindass will explain, there are some things that we can do so that we don't end up with really very serious side effects from the virus.
Great. Dr. Sindass, can you share with us how were the FDA approved COVID vaccinations developed so fast, and are they safe?
Well, again, thank you, Grace, for having me today. I'm very excited to always work and share medical information with CAFE and the families and friends. So this is the number one question that I hear when I'm walking in anywhere, in the grocery oh no, I'm not taking that. It was made too fast. And you hear it everywhere. I don't want to take it. It was made too fast. Well, the reason it was developed so fast is because we are in a pandemic. Pandemic means the entire world is being affected. So essentially every scientist in the world who are interested and already involved in developing standard vaccines that we use for children and adults, they got onto the bench, which is the laboratory area you call the bench, and started thinking, how can we get this? Now, when the virus was first determined to be a new virus, later on time, they did find out the actual genetic code or the actual definition of what it is. And once that was released to the general public of scientists, they went in and people were trying to find out how we can either make a vaccine or determine a cure. And since so far no one is able to determine a cure, there have been vaccines developed. And with with one, having all the scientists all over the world trying to come up with ideas, and two, big companies, small companies easily were getting funding. And that was the main reason it happened so fast. The usual process is about a 3 to 5 year process of getting a vaccine from beginning to end to actually seeing it in your doctor's office or clinic. And that's a long time. And that's because it takes 3 trials. There are 3 levels of clinical trials. And even before you get to the clinical trials, you have to find the volunteers. Before you find the volunteers, you have to find the money to improve demo, let's say. So that's the issue. And in this vaccine took 10 months. The ones that were FDA approved, Food and Drug Association is the approval entity in this country, and they pushed it through using designating it to be EUA certified, which means it's an emergency use authorization by the FDA was put forth for the Pfizer and Moderna vaccines. Pfizer and Moderna are a combination, they joined other forces, other scientists, and put monies together. So yes, 10 months is very fast, but it's safe because they were not looking at any other trials. They were only dealing with this one issue, which is affecting everyone in this earth. And they had the money. And when the trials went forth, they had 40,000 plus people for the Pfizer. And that's a large number. They don't usually get that many people standing up and volunteering. So it went through. And the reason it seems to be safe is because they both have very high efficacy, 95 and 94% each for each vaccine. And so far, 34 million people have received the vaccines to date, and at least 1 or 2 doses by now. And over 10 million have received 2 doses of one or the other vaccine. So far, it's looking very good in terms of safety.
Is there a particular age demographic that this would be preferentially used for?
Yes.
There is?
There is, because the trials were only done on adults 18 and above. They've extrapolated down to 16 and above can get the Moderna vaccine, actually. And so at this time, they have started trials on children, but it has not been approved for children in any form or fashion at this time.
And therefore, what you're saying is that the general age demographic is anyone who's 16 and above?
Yes.
Is it mandatory?
It is not mandatory at this time. They're really highly recommended. It's highly recommended, but not mandatory in any shape or form. There is some discussion that the Restaurant Association is thinking of doing that for all restaurants, because I mean, this is where people have to eat, and that might be something they're looking into. But in terms of other sources, no, it's not mandatory.
So can you and Dr. Mazique tell us, how will everyone in the world obtain a vaccine?
Well, there is an agenda going forth from the World Health Association, a group called COVAX, who's specifically working to make sure that developing nations have access to the vaccines and in terms of buying them, because, for example, the Pfizer and Moderna are $45 and I think 20 something dollars for Moderna. And there's one vaccine that India is going to use, and that's a $3 to $5 per vaccine. That's a big difference.
Definitely.
So how do you, there's billions of people in India alone. So we're talking in the Caribbean, for example, where my family's from, they have many islands have been getting, they are going to be getting vaccines through that process of the COVAX under PAHO, who's going to help pay for those vaccinations and allow it to be, rolled out in smaller batches
Mm-hmm.
in an affordable fashion.
Amazing.
I'll just add to that, that the World Health Organization, they have been, from the very beginning, looking at this pandemic, and they, along with COVAX, as Dr. Sindass mentioned, they are allowing the countries that are less financially secure to be able to get vaccines for their population.
Well, there are 3 that are new COVID-19 variants. So a variant is when the virus mutates into another form to survive. So our common cold virus does it every day, and every few days, probably a common cold virus, which is a type of coronavirus. And the flu virus does that as well every year. And that's the reason why we suggest that you get the flu vaccine every season for the flu season, because the virus itself mutates to survive. So COVID-19 is also doing this as well. And there's so far been 3 they have determined in UK, Brazil, and South Africa. And they are 1.5 times more infectious. And that is a concern because we are working on just dealing with COVID-19 itself as a novel virus with the vaccinations. The current vaccinations so far seem to be able to prevent you from getting infection from the variants, because the variant also has a similar structure with the spike proteins or little crowns on the surface of the cell of the coronavirus, COVID-19 virus. So far, they are hopeful that they can decrease the amount of infectious rate with the new vaccine before the variant takes hold.
Yes, I think just to add to a little to that, we have to keep in mind, like Dr. Sindass said, viruses mutate because that's how they survive.
Mm-hmm.
And so that's why it is so important for everyone to be vaccinated, because that's the only way that we can get to herd immunity, where the viruses will have less of a chance to mutate and continue to infect, because that's what viruses do. And if the population, and that's why it is so important for people around the world to realize that this is the reason why we must be vaccinated. It's the only way to stop the spread. Because if we're not vaccinated, if we don't reach herd immunity, this virus is going to continue to mutate and continue to, infect us. So we may get to the point where we may need to have a booster of the vaccine every year, just to be able to stay ahead of the virus mutating and keep, changing its little spike proteins to keep us all infected. So that's one of the ways, is by being vaccinated. And Dr. Sindass can speak to the methods in which the vaccines were made, the messenger RNA. I think that's important for us all to understand why the vaccine was made, was able to be made as quickly as it was.
Each person has to look at who they are, what are their risk factors, do you have any medical problems? Then you look at your age. Does that associate you with a risk factor? And then you still have to look at the general masses of people all over the world who just had a simple little the coronavirus. It seems simple at first, and it progressed into something severe, and many people died. And so when you add the fact that you might have many risk factors, this virus is not leaving, it's brand new, and we don't know how long it's going to be here. And we see it going through waves and waves of every country in the world. Then you look at, okay, now there's a vaccine for it. The vaccine, okay, it might hurt. That's one of the factors. You might have a little soreness, might have a little fever. We haven't had the high numbers from people dying from the vaccine, but we have high numbers of people dying from the actual illness and significantly our seniors who are 85 and above are the highest risk.
Ooh, I'm safe.
Well, 65 and above is every day ticking toward an increasing risk, but yes, each level has a different risk, but there's no one with zero risk. So if you want to look at the vaccine and say, oh, I don't want to take it, it was made too new, it's going to change something in me, but are you going to die? No, we don't have those. When something has 94% efficacy, many of the vaccines that we have that we take every day do not have that high efficacy, and it has been helping our society. I think this is a time where people are learning more and more about vaccines in a general sense, and now they are seeing all the exact numbers about them. Now, this vaccine that is out, the Moderna and Pfizer, are messenger RNA vaccines. And what does that mean? Made from a messenger RNA. Yes, they do know the DNA of the COVID-19 virus now. So they took a snippet of its code from the spike protein, which is the outside layer, the little crowns on the surface of the virus itself. They took a snippet of it, not enough to copy and clone. They can't do that with this messenger RNA. It's like a picture of one portion, and it's enough. They add it to some fat, introduce it to your body through the vaccine, and your body will form its own protein, and that protein will tell your body to make antibodies. Antibodies are warriors that will come out anytime that your body in the future sees or is experiencing or exposed to COVID. It will send out antibodies. And that's going to save you. Instead of you getting the infection and risking not surviving, you have antibodies, but you didn't survive. So that's not going to serve you. So we are not willing for you to take the risk of getting the infection to get antibodies. And we don't know if those antibodies will last as long as we need them to. And because the virus is, again, changing and forming new variants, again, those antibodies might not serve you. So yes, a booster might be in place in the future, but at least you who have never had the virus will be covered. And that's really where we're at, and that will provide the herd immunity we need. 60 to 80% of people vaccinated to protect all those who cannot take the vaccine, such as those who have very weak immune systems and such as suffering, they're doing chemotherapy and things like that, and they have cancer. So we need to protect the high risk persons who cannot take a vaccine. That's very important.
You're asking too about the hesitancy in terms of getting vaccinated.
Yes.
And I think culturally, there's a huge piece. A lot of us culturally think that ginger, moringa, steaming, things like that will, because there's so much on social media. But those things will help in terms of our immune system overall. And we can certainly do those things, but it certainly does not take the place of getting the vaccine.
Mhm.
And, it's just really important to realize that, yes, we can do those things, but we need to also take care of ourselves in terms of getting vaccinated so we don't keep any, we don't end up with a pandemic that just would not go away.
So let's talk about the kids. And I know that how does the COVID virus affect children?
So fortunately, most children have done very, very well for the ones who have contracted COVID-19. Actually, the youngest patient that we've had in the practice was 22 days old. And that baby have done, all of the children have done great. Um, so the one issue that we find, it's a multi-system inflammatory syndrome in children that can be very, very severe. And they had a lot of different aspects to that illness. And the children end up most of the time being in the hospital so that they can get the supportive care that they need. It's very rare, and it akins itself to another illness that we know called Kawasaki disease. And so it attacks the immune system, and there's no cure for it, as we know that. So they just have to be supported. But most children will have maybe a slight rash or could have some vomiting, a fever, but they usually do very, very, very well. With the multi-system inflammatory syndrome, they will have a red eye, they would feel extra, extra tired. The fever would last for a very long time. But to answer your question specifically, kids do very, very well. And
That's
so,
encouraging.
yes, it's very encouraging.
So what would you say? And please, I invite both of you to share your thoughts on this, because I think our population is at that crossroads. Should kids be ready to return to school?
So that's quite an open discussion right now, primarily because there is so much about COVID that we don't know. The teachers, they are very hesitant because they're not vaccinated. And as you know, across the country, there are a lot of protests by, teachers unions because the teachers feel uncomfortable going back into the classroom. And so I think a lot of school systems are allowing them to, make a personal decision whether or not they would like to go back to school. Some school systems, they're allowing the kids to go back to school, doing all of their social distancing, doing all of the hand washing, the hand sanitizer, etc. But they're having monitors in the classroom to monitor the kids, and the teachers are still on a video screen. So that, it's not ideal, but what we're seeing with the increased psychological effects with children at home doing video school, sometimes it's easier if they were to go to school, even though they'd be, on a monitor. It's not ideal, but that's what is being done now. Um, a lot of the teachers aren't vaccinated. There's not a vaccine for children. So I would safely say the jury is still out in terms of what may happen with the kids going back to school unvaccinated. A lot of the teachers are not vaccinated. And however, a lot of the CDC, they have said that it's safe to go back to school with all of the hand washing, social distancing, etc. That is safe for children to go back to school. So as healthcare providers, we have to also look at the entire aspect of the child. physically, socially, psychologically, economically for the parents, etc. So looking at everything in total, that may be the correct answer for some children, and for parents who still feel uncomfortable, keeping the kids at home and providing what they need at home would be an answer for that population.
So we now also have in the same context as we're trying to be protective, we have now not only is there the masks, the actual face covering, the selection of masks of all different fashions included, but now there's also the I guess the over the masks wearing that is now becoming quite common. What are going to be the typical masks required moving forward, and maybe even potentially for how long are we going to suffer through this, to be honest with you?
Well, not as bad as we think. And if we kind of liken it to some cultures that do wear head tie,
Okay. Mhm.
burqas, and hijab, um, they have made just an additional piece to come up a little higher or whatnot. I think maybe we just have to be patient. We really have to get our mindset around this and say that's something we can do. We can still go out and take a walk and go out to social distance and stop by the uh, mall or something like that, but we have on our masks. So it's coming into favor where people are wearing double masks now. And the CDC is not against or for. They think, well, it might actually be helpful. And they are doing the studies right now because they are showing some interesting videos I've seen where if you sneeze with the mask on, it does really help not allow the sputum to go, that 6 feet. It doesn't reach the 6 feet, about half of that. That's how they got to the 6 feet distancing. So did sneeze with the mask on, it will go about 3 feet. Without the mask on, it could go potentially up to 6 feet. And so that's how they originally came up with that guideline. But with two masks, you have even less distance that sputum can go through the mask. So they're suggesting that since a surgical mask is thin and it's kind of, it's slightly waterproof and you can breathe a little better, and leave the N and the K95 for professionals in clinical areas, unless you are a certain person of very high risk. Then that simple surgical mask and a colorful, any beautiful, delightful mask can be put on top. And you have extra protection. You can always wash the one on top and use the other one on the inside a little longer, and that'll be cost effective for a lot of people too, because the single cloth sometimes is not enough layers. So it needs the one mask that you wear should have like a 3-ply, not just like some people just pull their t-shirt up, or that's really not helping you, maybe for a quick pass by, but you really need an official mask that has a little 3 layers, and the sides should fit to your face. So you might have to twist it to make it actually come onto your face, the one that's on your face, because many people have it hanging below their nose and the sides open, and that's not helping the person or your neighbor.
So I think also, a face shield by itself is not protective.
No.
And the wearing of the mask is what is recommended and actually required. And so saving the face shields for the professionals with their, who really need it, along with their KN95 is what's suggested.
Yeah.
If I were to look at how soon we can really get back to some form of normalcy, I really think it all depends on the rate that we're vaccinated and what, how many people are and how quickly. So education of the safety of the vaccine, encouraging people to get the vaccine, spreading the word that it's safe. And again, it's safe, but we would not know until there are long-term studies. So, but right now, from what we know, it's a safe vaccine. And I think that's one way of doing it. In the meantime, we can follow the CDC's guidelines. They have a certain number of people, believe it was 10 people, or that they would be, that can be in a space with their mask on, with the social distancing and with everything else that they have, that they know that, well, that we know that we need to do. So I think the vaccination would be the main thing right now,
Mhm.
along with continuing to do all of our social distancing, hand washing, and math, everything that we're supposed to do. In addition to that, I think we don't know how soon children will be able to be vaccinated. So that will be another factor, because one of the important things to know is that if you're vaccinated,
Mhm.
you can still be exposed to COVID and have it in your nasopharynx, and you can infect someone.
Mm.
Mhm.
So even though you're vaccinated, so that's why it's important for everyone to be vaccinated.
And there's
Uh,
mentally, we do need connection. And a lot of issues came out because of COVID-19 pandemic. And I would be remiss if I didn't mention a lot of the social injustice issues we've been having, and Black Lives Matter. They have stood up and said, yes, we have a lot of issues that we have to deal with as a community, as a nation. And then we had this new vaccine came out, and it was made fast, and it is safe. But because we have um, racial disparities in who has been most infected, Black and Brown people with COVID, um, this has put another layer to the whole um, anger of about the social injustices of the past related to healthcare. And so we have to address that now. And at this point, if you are in the first in the line to get this COVID vaccine, we should be the first in line to get them. To get the if you're first in line to get the infection, you should be first in line to get the vaccine. There is a movement. Many groups are saying yes, that should be something, and I think everyone deserves the right to get the vaccine. But um, because of so many things that has happened, that is a common discussion right now, and so I think people of color should think about that, not wait and think about what happened in the past with healthcare issues and the Tuskegee experiment and things like that. They did they did do some severe wrongs, but today we are disproportionately um, suffering from the illness and dying. So I believe it's one issue that people should really think about. And I've heard some people say, well, what's inside the vaccine? They're trying to hurt us as people of color again. And what's in the vaccine, it cannot change your DNA, cannot harm your body or system. It's a snippet of the messenger RNA and some lipid fats, and it's the protein forms in your body. We have many other vaccines that are actually live. This is not a live vaccine, and it's not giving you a portion of the COVID in terms of the whole entire DNA of it. So it's very safe. And I, for one, suggest that people think about that issue and put that on the table and use that energy for other things.
Would the vaccine now be available across the board uh, to the public, or is there any costs that would be associated with getting the vaccine?
So this new administration, I think, have really moved ahead in terms of making sure that the vaccine would be available to everyone. They are now having these huge sites at stadiums and things so that people can get vaccinated, because for a long time, there was a lot of difficulty in terms of getting the vaccines to the people. The vaccines were shipped, but they weren't administered. And I think that now getting the vaccines to the pharmacies, because most people live within 10 miles or so of a pharmacy where they can sign up to get it there, I think that that will increase the population of us that will be able to be vaccinated. So I think that those factors will really be impactful to get everybody vaccinated.
Well, I want to say thank you to both of you. Is there anything that we might not have touched on that you feel is critically important to make sure that first and foremost, our family of cafe, um, parents and children should know at this time, as well as our viewing audiences and our populations?
Well,
I think with our population, with our population at Cafe, we were fortunate to reach out to someone because, again, we're looking at reaching as many people and to dispel a lot of myths about the vaccine. So we were fortunate to have a staff member to translate, and will be able to give a summary of this talk, because it is critical culturally that we know that it's safe and it's something that we should do. So I think that's one of the key parts, in terms of the discussion right now, in terms of trying to get ahead of the pandemic.
Okay. Dr. Sindass, do you have any further thoughts that you'd like to share?
I just want people to remember that even when you get the vaccine, be open to take whichever one they have available. There are some new ones coming, the Johnson & Johnson, which is only one dose, and it's almost emergency use authorized. And second, we still will have to wear our masks for a while. Single or double, just make sure you wear one when you're going out. You'll still, even if you're vaccinated, still will have to do a little social distancing. Well, physical distancing. You probably will be able to do more social, but we'll see how that goes. That's coming. But physical distancing is important. Washing your hands, using hand sanitizer as much as possible, coughing, even with your mask in your elbow, and avoiding crowds, but eating a healthy diet, drinking water more than juice and soda, getting your vitamin D. Do not stay in the house 24 hours a day, 7 days a week. You can go outside. You can walk and ride a bike. You can go and errands. Just watch how you're doing. If there's a crowd coming down towards you and you're on the sidewalk, go the other side. But try and keep those things going, and you can live a healthy life, and also sleeping.
Doctors Mazique, Dr. Sindass, and Nurse Diane. Again, Diana,
Yes.
thank you so much for taking the time to share your expertise and your information, guidance, consultation with the cafe community and our public at large, because this information has been so invaluable. And we can't tell you how much we appreciate that you've taken the time to share these, highly important COVID-19 follow-up concerns with our audience. We are so thankful. Thank you, doctors, again, Dr. Mazique, Dr. Sindass.
Welcome.
Deanna, thank you, most welcome. Have a great evening, all of you, and thank you for joining.
Thank you.
Thank you.
So.